Hi everyone, thank you for coming to this cast live. My name is Kaylee and I'm a freshman at Calumet High School hoping to become an anesthesiologist. I would like to thank Young Women's Academy for joining and participating in this special cast live. Today's speaker is Dr. Barbara Taylor. Dr. Taylor is Associate Director Professor in Infectious Disease and the Assistant Dean for the MD and MPH Program at UT Health San Antonio. She has also chaired the COVID-19 transition team, appointed by Mayor Ron Nirenberg and County Judge Nelson Wolff. So she is here today to answer any of the questions that you have. So if you have any questions, please put it in the chat box and let me know if you want to talk to her or do you want me to talk, or do you want me to ask her myself?
Okay, so it's really an honor to be here. I'm so excited to speak to you all and answer questions. Our goal is to make this informal. So I am an infectious diseases doctor, which means that usually I take care of all sorts of infections. My research interest is usually in HIV, but over the last 2.5 months, I've done very little other than COVID-19 work, including work with, I do direct patient care. I work at University Hospital and at the Robert B. Greene, which is downtown near some of our campuses. And I also work in an outpatient virtual clinic now for people with COVID-19. And I have worked with the city and the county and with an amazing team of 14 health leaders to help give guidance to the city and the county on how to reopen safely. So I know there are students from many campuses, including a rogue representation from ALA by Bella Villarreal. So we thought it would be best if we just opened it up and had y'all ask questions. I'm happy to answer basic questions about COVID-19. What do you want to know? What is it going to look like? I can't tell you what school's going to be like in the fall, so I cannot answer that question. Or if you want to know anything about what the epidemic looks like in the city or what we're doing to fight the epidemic, I'd be happy to talk about anything.
Okay, before we go, I would like to start off with the first question. What is one thing that you have learned about yourself during this pandemic?
I have to say, I've done a lot of interviews over the last 2 weeks and no one has asked me that. And I think it's a really good question because I think we're all learning a lot about ourselves in this pandemic because we are in unprecedented times. I mean, the last time this happened was 1918 and I don't think any of us were around at that point. So what have I learned about myself? So I feel like as an infectious disease doctor, for the last 10 years, I teach here at the medical school and I stand up in front of the first year medical students. And when I'm talking about influenza, I say, there is going to be a pandemic in our lifetime. And so if anybody should have been prepared for this, it should be us, infectious disease doctors, and me in particular. Like we've known this was coming. And I think even with that knowledge, it is really hard to see it happen, right? It's been really hard to watch our city shut down. It's been tough to watch all of my colleagues. I did all my training in New York. And so many of my colleagues and my closest friends are really on the front lines there, and they have had a hard time and people have gotten sick. And so it's hard to watch that happen. And I think some of the things that I'm learning about myself are that my tendency is to work all the time. And so I am really grateful to have a family who reminds me that this is a marathon, not a sprint, that this will be something that we'll all be dealing with for the next many months, unfortunately, if not years, and that I need to take care of myself as well as take care of other people. And so I would say those are some things that I have learned about myself. I'm not saying that I'm necessarily that good at that. I'm working on it. It is a growth area for me.
What is one thing that you've noticed that you've taken advantage of before the coronavirus outbreak and wish you had taken more time to do?
Oh, gosh. So that's a great question, Honor. I feel like I miss travel. Like my family had actually planned, we hadn't told this to Ms. Arzamendi and the YWA people, but we were actually planning to take a vacation in mid-April. And it was a family vacation. It was gonna be during school and we were gonna sort all that out. But all of those plans went away. And I really love traveling with my family. And so I wish that we had done, like, I sort of wish that we had taken a spring break not in San Antonio, because now we're not going to be doing that. So.
Okay, so the next question is on behalf of Delia. I'm sorry if I said your name wrong. An essay, what factors or elements are being monitored considered by the essay task force to determine if students can go back to school?
That's a great question. So that's from our head of school at YWLA, Principal McLaren. So I actually, if it's okay, I can show you all. So one thing to be clear about is, as far as like who's going back to school and when, that's not a decision that's going to be made, certainly not by the health transition team. So the health transition team sort of was convened. Our job was to create some guidance, and then we put that guidance out, and that is now sort of out in the world, and we gave it to the mayor and the judge, and they are basically operationalizing it, and their job is to turn it into policies and procedures. So in some ways, the health transition team's job is done in terms of our guidance, but and then I think the decision making about going back to school is really going to be made by the state board of it. I understand from Superintendent Martinez, who sat on the economic transition team, that that's really being made by State Board of Education and state powers that be. Definitely not me, so please don't blame me. But there are some things that we can look at to figure out how we are doing as a community. And when we got together as the health transition team and looked at what are the factors that we would want to see on a dashboard to let us know how we're doing in terms of the COVID pandemic in San Antonio and in Bexar County, we came up with a set of indicators. And I'm going to share my screen really quickly so I can show you all what those look like. So these are, and I think, can you see them? Yeah. Not yet. How about now? All right. So these are, you'll see they are divided into progress indicators and warning indicators. Anyone, if you are interested in science or just interested in data of any kind, you can look at this. I look at this every day. It is on the San Antonio Metropolitan Health District website. So if you go to sanantonio.gov and click on the COVID button, which is like right in the center of the website, it will take you to this. And this is the progress and warning, and they have several different dashboards. This is the progress and warning indicators dashboard. So in our report, we used a lot of other guidance. So it wasn't just 14 people in a room. We used a lot of other plans and other reports and other very smart people who had put together ideas about how one monitors the COVID-19 epidemic. And one of the first indicators that we looked at was actually this one, which is the graph that you see that says previous 14 days of reported onset date. So this is what we would call in epidemiology the epi curve. So this is how many cases we've had in San Antonio since April 24th. And if you look at the graph, you can see that it's sort of going down. So that's a good sign. And in the federal plan, the guidance for opening America, as well as in our guidance, we all thought that it was important that we look at a trend that would be going down as far as numbers of cases in San Antonio and in Bexar County over the last 14 days. Other things that we look at pretty closely are how many folks are in the hospital. So these right now, there are 66 people who are hospitalized with COVID-19 in San Antonio. There are 43 folks in the ICU and 27 of them are on ventilators. Those are the machines that help you breathe. The other things that we thought were important to look at were testing and tracing. So that is something that everybody is talking about. We need to know if we're going to respond to really any illness. If you think about it, you have to be able to identify that illness, and you have to be able to find the folks with that illness and offer them care. And then in the context of an infection, you have to work to make sure that someone who currently is ill is not putting others around them at risk. So this gives you an idea of how many tests we can do in San Antonio per day. Right now it's 1,600. In the next 2 weeks, probably 3, we'll go up to being able to have more than 4,000 tests a day. Now that's just testing capacity. It doesn't necessarily mean that we need to use all 4,000. Well, our target is 3,000, but I think actually we're going to exceed our target. But it doesn't mean that we actually need to use all 3,000 tests every single day, but we need to have that capacity. And even more important than having just tests available, we need to make sure that tests are available for everyone. So one of the things that the epidemic has clearly highlighted is the health disparities and the issues with equity, not just in our own city and our county, but statewide, nationwide. So who has not had access to testing? People without insurance. So Texas has the largest percentage of people without insurance in the country. Who has not had access to testing? Communities of color, low-income communities, people who are migrants or asylum seekers. There are many reasons. We know that the LGBTQIA+ community is less likely to access testing for COVID. So there are many reasons that people are marginalized and might not be able to access testing or be nervous about accessing testing. And so we have to make sure that testing is accessible to everyone, because we want to address the epidemic in everyone, not just in people who have health insurance or in people on the north side of town. We want everybody to have access. The other part of it is tracing. And so testing is fairly obvious, but tracing is something that is very much an epidemiology, sort of public health bootstraps activity that a lot of people haven't talked about until recently. So what does tracing mean? Tracing means if I have COVID-19, then someone needs to call me and find out who are all the people that I have been in contact with in the last 14 days. And then they need to reach out to those people and find out if they are ill or if they have symptoms or if they want testing. And then if those people are ill, they need to get tested and linked to care. And then you need to tag those people and ask them. And so it becomes like this concentric expanding circle phenomenon. If you do that effectively, so say I have COVID-19 and I get tested and I'm positive. So Bella is going to call me and she's going to say, hey, Barbara, I hear you have COVID-19. Who's living in your house? And I'm going to tell her. And then she's going to tell me to stay away from those people, especially the people in my household who are medically at risk. So she would say, you should really stay away from your parents because they are over 65 and they are medically at risk. So that's how that works. So if we are doing an effective job by tracing, we actually can make sure that though I am infected with COVID-19, don't lead to more infections. And we can head off epidemics and hotspots at the pass by not doing that. So that is a very long explanation to the question of what are the indicators and what are we looking at. There's some warning indicators too, which I won't really go into, but one of the important things is the health system stress score. That sort of tells us how much capacity of a health system we're using and how we might or might not be exceeding that. And so that's something also that the Emergency Operations Center and Metro Health and STRAC and the people who are responding to the epidemic watch to make sure that we're not getting over capacity.
Does this outbreak cause you to lose time with your family? If so, how do you feel about that?
So perhaps we should ask my daughter who's on this call, but I would say yes, it has. I am definitely working more and longer hours. There were some pretty bad weeks where I never made it home for dinner. But in some ways, this is what I signed up to do. You know, I became a doctor, and I specifically became an infectious disease doctor because I was passionate about helping people who had infections. And so if there's ever a time for people like me to step up and to work harder, it's now. And so I think that's what we're all trying to do. And it's really been amazing to watch all of my colleagues in infectious diseases, my colleagues in public health, my colleagues and friends who work in environmental services in the hospital who are cleaning the rooms. All of us have had to work longer and harder to try to keep everybody safe. And I think I don't want to speak for everybody, but people who I've talked to have been really happy to do it.
All right, thank you. The next question is from Dr. Rodriguez.
Thank you for joining us. Thank you so much. My question was, how soon do you think there will be a vaccine available for everyone to prevent it, or a treatment for those that are infected? And is there a race around the world to create a vaccine? And would this vaccine actually cause, like, for a quick solution, being that it has to be disseminated?
Yeah, so that's a great question. And I would say that that's the thing that would be a game changer for how we're responding to the epidemic. So those two things are separate. So let's talk about treatment first, and then we'll talk about vaccine. So as far as treatment goes, for both of them, there is definitely a race around the world for science to catch up with this new virus. So for treatment, there are actually a bunch of different treatment options that are already in trials now. We are University Health System and UT Health are working on one of the largest NIH, National Institutes of Health, funded trials to study a drug called remdesivir, which directly acts to kill the virus. Some preliminary data from that study came out 2 weeks ago, and it actually showed that remdesivir, this agent, does decrease mortality from COVID-19, and it also decreases viral shedding and the length of duration of your illness. So that's good news. It's not a panacea and it's not a cure, but it's definitely progress compared to so far what we've seen in other randomized control trials for other agents have all been negative results. So they trialed a drug called lopinavir ritonavir. They trialed a drug called hydroxychloroquine. Both of those didn't look like it actually improved outcomes for COVID-19. So that's really encouraging. And I think treatment is likely to be available within the next 6 months, which is different from a timeline for vaccines. So the other thing I would say about treatment is having the treatment and proving that it works is one thing. Getting the treatment to people who need it is a whole other thing, right? And so we've already talked about the number of people who are uninsured in the state of Texas. As someone who works at the county hospital, we know that not everybody has access to treatment. And so I think that's something that has to be at the forefront. We have to think about equity and access to any treatment that is developed, as we will have to with the vaccine once it's available. As far as vaccine, that's a longer timeline. So there's actually, I wonder if I can find it quickly. I'll try to find it and put it in the chat, but there's a website that you can go to that basically lists all the vaccine trials. And so if you are geeky again and want to watch data, there are a lot of vaccine trials out there. The last time I checked, there were only a few, under 5, that were out of animal studies and into sort of phase 1, or even thinking about phase 1 in humans. Timeline for vaccines, the most ambitious timelines that I have seen quoted are 12 months. That seems very ambitious. for a vaccine. I would say probably a more realistic timeline, and I would love to be proved wrong. So don't get me wrong. If we have a vaccine in 12 months, that would be amazing. But I would say more realistically, we're probably thinking about 18 months to 24 months for a vaccine. And the vaccine really would be a game changer, right? A vaccine means we don't have to worry as much. It means that the folks who are at risk for medical complications can be protected. So I think, did that answer your question? Okay. Hi, Mr. Sierra.
Hi. Knowing that so many of our current and future challenges will need to be addressed by the next generation of scientists, medical professionals, and technologists, what are your thoughts on the current state of STEM education? And how do we take an experience such as this pandemic and use it to inspire our young people to pursue these challenging pathways?
That's a great question. I am hoping that we are doing that now, right? So one of the things that we have done is harnessed a lot of the energy of our medical students and our public health students and our nursing students to volunteering in the epidemic response. So we have students who are learning how to be contact tracers and working with Metro Health. We have students who are designing infographics to push out to the community. We have students who are doing reviews of evidence-based medicine to give to the clinical teams in the hospital who don't have time to sit and look through all the literature. I think STEM education, as I don't have to pitch to you all, starts early, right? It should start in elementary school. And so I think making sure that students have exposure to science and math and engineering and tech, and not just exposure, but practical experiences doing it. I know that it is really different. And, you know, based on my own experience, I didn't have a lot of science work in like sort of practical science work until I or interest in science until I started doing it. And I was lucky to, I went to elementary school in Florida, and we had an outreach program where kids from the public school could go and work in marine biology. And so my first desire for science was to be a marine biologist. And so I think the impact that y'all are having in teaching students and having them actually do the stuff rather than just do it on a worksheet or memorize facts is really important, and that's where we go.
Okay, thank you. So the next question is from Maya. Maya, are you on? Would you like to ask your question?
So when you hear about people, the doctors and nurses quitting, how does it make you feel, and are you well equipped with supplies?
Thanks for asking, Maya. It is so hard when I know that we are very lucky in San Antonio, and I feel very lucky at University Health System that I have really not had to worry about having supplies. Because I think San Antonio was a little bit more prepared, I think we got sort of an early warning with the folks who were at Lackland. And I also think that our emergency response group is pretty on point. They work to organize and order supplies early on. So that's been a different experience in other places in the country. And I know that there are folks who have gone without, and that's not something, I think ethically, it is very hard to ask anyone to try to respond to an emergency without the tools to respond to that emergency. And so I think it's understandable that people are stressed. I think that the things that I said at the very beginning about making sure that we're taking care of each other is incredibly important in the context of a pandemic, because you do feel vulnerable. And so I don't fault people for quitting. I think it's understandable. And I think that we have to work to create systems to make sure that people feel protected. I personally, working on the COVID service, feel, nothing is risk-free, but I feel safe. I have all the tools I need to keep myself from contracting COVID-19, but that has not always been the case everywhere in the pandemic.
Hi, thank you. So the next question is from Alicia Gonzalez. So she said, hello, Dr. Taylor. Will weather affect the spread of COVID-19?
That's a great question, Alicia. There's been a lot of debate about it, about whether or not, so SARS-CoV-2, which is the virus that causes COVID-19, is an RNA virus. So that means that it's a little bit fragile. That's why bleach and soap and everything like that, you should wash your hands, because that definitely kills it. You don't need any kind of major toxin to kill this virus. It also means that it doesn't like heat. It degrades and denatures in heat. How much heat is unclear. You know, it seems in some of the models that we are seeing less spread as temperatures rise. On the flip side, Italy had the surge of its pandemic during a heat wave. So I think the real answer to your question is we're not sure yet. We may see a decrease in cases over the summer because of the heat, and we would hope that that would be the case. In that case, San Antonio, Texas remains a great place to be because we know it's fixing to get real hot. So, but we don't really know, and I definitely would not count on it.
What are your thoughts on using young medical students on the front line of this COVID-19 pandemic?
That's a great question. So I should be clear that our students are not being asked to be on the front line. And in fact, because there are a lot of ethical issues, right? We do not want to coerce people to put themselves in harm's way. Like I said, I signed up for this. Like I became an infectious disease doctor. That means that I walk into rooms with people who have tuberculosis. I walk into a lot of infectious pathogens, and that's what I do. That's my job, and I'm trained in how to do that. So for the medical students, when they're volunteering, we have to be good stewards of their education, and we have to make sure that we're not coercing them into doing anything that is risky for them or puts them in harm's way in a situation where they wouldn't be able to say no to that. Which means that actually at the beginning of this pandemic, our medical students stopped being able to work in the hospitals. And that happened nationwide. So imagine, y'all have all had to shift to online learning. Imagine if you're in medical school and your entire medical training is a clinical experience in a hospital, and suddenly you can't do that. That's been really hard, and our medical students have had to deal with a lot of uncertainty, and they've dealt with it really gracefully and graciously. But I think that we, as the faculty of the medical school, have to be really careful about what we ask of our medical students. So the other category of trainees who we train are residents and fellows. So those are people who finish medical school and they are specializing in various fields and they're working in the hospitals. So even in the context of our residents and our fellows, we have not been asking them to work on the COVID service. Now that's different from city to city. A mentee of mine is in Chicago, and another mentee of mine is in New York, and they are working in the hospitals because they're needed, but they are trying to make sure that it's not being done in a coercive way because they are trainees. And similarly in New York, the medical students were also all sort of released from clinical duties during this time of the pandemic.
I've been hearing in the news that the COVID-19 can last up to 2021, and I also hear that the curve's also going down. Is it possible that it can rise up?
That's a great question, Mariana. So I think if I heard you right, the question is COVID-19 could last till 2021, and also the curve is going down. Is it possible? Could it go back? And so the answer to both of those questions is yes. So the curve, if you look at our curve is going down. That is not the same in many other places. Like if you look at even Houston or Dallas, they are not having a decrease in their epi curve, or their epi curve is not dropping as quickly as ours. As far as how long it lasts, it's really hard to tell, but until we have a vaccine, it's likely that this virus will continue circulating. The question of whether it could go back up, it definitely could. And that's why we're, that dashboard of indicators I showed you earlier has some warning indicators that we want to pay specific attention to. So we're doing more and more testing. So if the number of tests that are positive tests starts to rise, then that, or the percentage of tests even that are positive tests starts to rise. Because as you're doing more testing, you expect to have more positives and more negatives. You are hoping to have more negatives than positives, which is why looking at the percentage is important. If you are doing more testing and the percentage of positives starts to go up, then that means we're heading in the wrong direction with the epidemic. And so, yes, one of the important things to recognize is that any reopening, which is what we're doing now, we're sort of permitting folks to go to restaurants and other places and asking people to be careful while they do that, brings risk. And along with that risk is the risk of more infections. So we will likely see more infections as the safe stay home orders get relaxed nationwide. I think the real challenge is making sure that we do everything we can as individuals and as a community to mitigate those risks, to try to make sure that we're protecting particularly the most at-risk people around us and marginalized populations, to make sure that we don't go backwards. You know, we can have a slow rise in cases and take care of everybody and take care of people medically, especially if we have effective treatment for people who are ill. But what we don't want to see is another sort of exponential growth curve of our epidemic, because that's when people get sick, healthcare systems get overwhelmed, and we have a hard time dealing with the morbidity and mortality, and we don't want to see more people dying.
Right, thank you. So the next question is from Coach Gomez. Coach, would you like to ask?
Hi, and you're doing a fantastic job, Kaylee.
Thank
So
you.
I was wondering, the statistics in Italy, yes, it was like devastating to hear the large numbers of fatalities and those infected, and it's just devastating. But do you think that the data is skewed because of the mean age of the population over there?
You know, it's hard. It is really hard to tell. There are a bunch of hypotheses about why Italy was hit so hard. I think some of them have to do with population density and population age and comorbidities and things like we saw in China as well, that folks who smoke have many more challenges sort of fighting the virus and recovering, especially from the pneumonia, than people who don't smoke. So don't smoke. I think it's hard to tell. Italy seems like a confluence of factors. There was the fact that they got hit early and weren't prepared in terms of so San Antonio had, January, February, March, we didn't have our first community case until March 13th. So we had that period of time to prepare, to get our systems ramped up, to have testing, to be ready. Italy got hit in a wave all at once. And when that happened, their healthcare system became overwhelmed. So when that happens and you don't have access to things like oxygen for people, then that increases both your morbidity, so your illness rate and your death rate. And so I think some of it was they got hit very early before we sort of globally had wrapped our heads around the fact that we were going to have a COVID-19 pandemic, the fact that their healthcare systems got overwhelmed, and then also probably some things about their population.
That makes sense. Thank you.
Okay, so the next question is from Bella. Would you like to answer or ask?
Sure.
Okay.
My question was, how has the way you guys are addressing the virus changed in the past few months?
So I have a question back for you, Bella. Do you mean in terms of how we're treating people who are sick, or how we're addressing it on a public health level?
I was thinking on the public health level.
So at the very beginning, addressing the virus was very much in San Antonio, was very much, okay, so where is it going to show up, and how can we contain it? And then as we saw more community spread, it's not that containment, some people like to put things into discrete categories, like you're either containing or you're mitigating. The reality is we have to do both all the time. So we are still working to contain the virus. So for example, Metro Health is now has already almost completed a survey of every nursing home and in San Antonio. And so they've gone through 15 so far to try to figure out who has COVID-19, how can we protect those folks, how can we protect the people around them. That is a part of containment, right? We're trying to make sure that that's okay. But the other part is mitigation. And so if you had asked me in January, as we were all watching the Johns Hopkins very early on had like a COVID tracker dashboard, and we were all watching the COVID tracker dashboard. You had asked me, were schools going to shut down because of COVID-19? I would have said no. And just the idea that a country like the United States would actually shut down society to reduce the spread of a virus seemed super unprecedented. And so I think our response has changed in terms of what we as a community, as a society, are willing to do to protect the folks among us who are most at risk. And I think that it's a good thing. It's a collaborative sacrifice. It's been incredibly hard for many people. But we've definitely saved lives. You know, the estimates most recently are that we've saved, you know, somewhere between 5,000 and 8,000 lives by our actions in San Antonio, and probably tens of thousands of infections. So it is working. And so I think now the question is, how do we keep it working as we move more into what is re-engaging in our daily activities?
Hey, thank you. So we only have time for one more question, and that is going to be, sorry if I mispronounced your name, Asai. Their father heard of a virus mainly affecting children. They were wondering if this is a COVID-19 virus or if it was a new virus affecting children.
That's a great question, Asai. So the thing that is affecting children, if I'm interpreting what your father heard of correctly, is there is this syndrome called Kawasaki syndrome that we've known about for decades, that affects mostly children, and it's actually an autoimmune inflammatory syndrome. So it's your own body kind of attacks itself and causes some pain and causes problems, and can cause problems with your heart and other organs in your body. So that has existed for a long time, and it's been very rare. And there was always the thought or the hypothesis that Kawasaki syndrome could happen to kids after they had been infected by a virus. And so sometimes, occasionally, we would see kids who had, you know, hand, foot, and mouth disease or other sort of standard viruses that all kids get, where they get their palms flake and things like that, and they get the slap cheek rash or things like that. And then they would get Kawasaki, but it was very rare. What we're seeing now is that kids who've had COVID-19 are developing Kawasaki syndrome. So on one side, it sort of proves the hypothesis that Kawasaki is created by our bodies trying to respond to a virus. And actually, we've seen this over and over with SARS-CoV-2, the virus that causes COVID-19, that the virus attacks your body, but then your body tries to attack the virus. And in attacking the virus, your body kind of goes overboard and attacks too much. And then you wind up with other consequences where your body sort of starts to attack itself a little bit. This is in people who get very ill. So that's what seems to be happening in these kids. The good thing is now that it's been recognized as a consequence of COVID-19 for kids, Kawasaki can be treated. And so people are now recognizing it and jumping to treat it before kids start to have problems with, say, heart problems or other consequences of the Kawasaki.
Okay, sorry, that wasn't our last question. This is our last question.
Oh, okay.
This is from Delia, can you explain the relationship between this virus and sugars in regards to how it replicates within cells? Does sugar in our diet affect our immune system with COVID-19?
So that's a great question. And I think that the answer is we don't know everything about it yet. But what we do know are that the balance, so our metabolism, and in particular how we process sugars and glucose and how we use insulin to regulate glucose in our body, is definitely affects our immune system. So if you think about the people who have the most issues with glucose and insulin and metabolism are people who have diabetes. So someone with diabetes has usually either insulin resistance or not enough insulin. And so you wind up with higher levels of glucose in your blood. All of those things actually lead to immune system issues, and your immune system does not work as well under those conditions. So we see people with diabetes have many problems with infection. So if you are living with diabetes, you're more at risk for tuberculosis, you're more at risk for bacterial infections because bacteria love sugar. And it seems to be the same for this virus. If you look at one of the risk factors for bad disease with COVID-19, it's diabetes. And so probably what it is the sugar metabolism affecting the immune system, which then the virus takes advantage of.
Hi, thank you so much, Dr. Taylor, for joining us today. We all really appreciate it on behalf of CAST. Do you have any closing remarks?
I just want to compliment you, Kaylee, on doing an amazing job moderating. As someone who does this a lot for students and classes, it's not an easy job, and you did a phenomenal job.
Thank you. I would like to thank Young Women's Leadership Academy for the partnership, and I would like to thank everyone for joining this very special edition of CAST Live. Thank you for all your time.
Thank you all. Please remember to take care of one another, wash your hands, stay 6 feet away from people if you can, and keep studying.